Hello everyone. A very good morning to all of you. Let me confirm if I'm clearly visible, audible. Am I live? Can you see me? Can you hear me? Give me a thumbs up in the chat box if I'm clearly visible, audible. If I'm live, I will start the class ahead. Give me a minute to confirm it. Okay, I hope it's working. Yes, I hope it's working. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I'm here to continue my crash course which I have launched few days back. This is a crash course specifically for second Prof MBBS students. Till now we have covered pathology. Today is pharmacology first day. Today we are going to start pharmacology crash course. In pharmacology, today I am going to start general pharmacology. So in general pharmacology, we have 4-5 chapters. The main 2 chapters are complete pharmacokinetics, complete pharmacodynamics. We have adverse drug reactions. We have routes of drug administration, and we have clinical trials. So all these chapters we are going to compile today in a compact manner for university exams. So I believe if you attend my crash course, you can get a distinction in the subject in your exam. So without wasting any further time, I would like to just start the session ahead. So before starting the session, there is a very important announcement for the learners, for the students, that Unacademy Learning Festival is going on. Now, what is Unacademy Learning Festival? In this festival, if you at rupees just 299, you can take 1 month NEET PG plus subscription of Unacademy. So this is a very exciting offer at such a low price, that is just 299. You can get plus subscription for complete 1 month. You can watch all live and recorded lectures with the top educators. You can use the question bank. You can use the live test and quiz, all India mock test. Everything will be available on the app. So you will have an experience of the plus subscription at just rupees 299. If you want to avail this offer, you have to apply my code before payment. My code is SACHDEV, Sachdev. My surname is Sachdev, Sachdev10. Sachdev10 is the code. So thank you very much. Now I'm starting with general pharmacology. General pharmacology, first I will teach you pharmacokinetics, then I will teach you complete pharmacodynamics. Today only we will cover everything. Pharmacokinetics, pharmacodynamics, adverse drug reaction, route of drug administration, clinical trials. We will continue with all these topics in just 3 to 4 hours. So let me start with pharmacology. In pharmacology, we have 2 branches. We know pharmacokinetics and dynamics. What do you mean by that? What is pharmacokinetics? Pharmacokinetics, what the body does to the drug. What body does to drug. That is pharmacokinetics. And pharmacodynamics is what drug does to body. What drug does to body is known as pharmacodynamics. You got my point? Give me a thumbs up. So what do you mean by that? Just suppose I'm having any disease. I'm having headache. I'm having heart failure, any disease. For that disease, I'm taking a drug to treat the disease, to cure the disease. I'm having migraine headache. So I'm taking a tablet to treat it. I'm taking an NSAID, painkiller or anything, right? So if I'm taking it by oral route, so first it will go in my esophagus, stomach and intestine. The drug will get absorbed from the esophagus, stomach and intestine, right? So first thing is absorption. So first the body absorbs the drug. After absorption, it will reach in the blood. From the blood, it will move to the various organs wherever its receptors are present. So if it is a drug of heart failure, maybe its receptors are present on heart. If it is a drug of migraine, maybe its receptors are present in the brain parenchyma. So this is known as distribution. Distribution is the movement of the drug from the blood to the organ. After that, the drug will reach to the organ. In the organ, it will show its mechanism of action. Actually, mechanism of action is pharmacodynamics. That I will teach you later on. But today, first I am teaching you pharmacokinetics. So after distribution, drug has done its job. It has shown its mechanism of action. Now I want to excrete the drug out of the body. So I want the excretion. Drug cannot remain in the body forever. Now all drug, its job is done. Its mechanism is done. Now we want to excrete the drug out of the body. So for excretion, the drug will go to the kidney. But kidney, most of the drugs are excreted in urine. Urine is water. So only polar drugs, that is water soluble drugs, can be excreted in urine via kidney. So most of the drugs are non-polar. So before excretion, we have to convert a non-polar drug into polar drug, that is known as metabolism or biotransformation. This takes place in liver. So body does 4 things to the drug. Body absorbs drug, body distributes drug, body metabolizes drug, that is convert non-polar drug to polar drug, and in the end body excrete drug. These 4 parts are parts of pharmacokinetics. You got the definition. Now have a look on the definition. What is pharmacodynamics? what the drug does to the body. That is mechanism of action of the drug. Here it includes mechanism of action of the drug. And what is pharmacokinetics? What the body does to the drug. That is body first absorb it, then distribute it, then metabolize it. Means convert non-polar drug to polar drug in liver. And in the and body excretes the drug via kidney. So this takes place in liver, this takes place in kidney. You got my point? What is absorption? Now see a diagram, a beautiful diagram. I have drawn this diagram for you. Can everyone see this diagram? Can everyone see this diagram? Give me a thumbs up if you can see this diagram. Now listen, can you see in this diagram, this is my drug. So just suppose this is my patient. My patient is taking the drug by oral route. So the drug is going in the mouth of the patient. The drug is going in the esophagus of the patient. After that, the drug is going in the stomach of the patient and the drug is going in the intestine of the patient. Now there is a rule. Acidic drugs are absorbed from acidic medium and basic drugs are absorbed from basic medium. For absorption, same medium is required. We have two types of drug, acidic drug, basic drug. Acidic drugs will be absorbed from acidic medium. Stomach have acidic medium. So acidic drugs will be absorbed from stomach. Can you see I have written acidic drug? All acidic drugs will be absorbed from stomach only because acidic drugs are absorbed from acidic medium. All basic drugs will be absorbed from intestine because basic drugs will be absorbed from basic medium. Give me a thumbs up. So acidic drugs absorbed from acidic medium, basic drugs absorbed from basic medium, right? Drugs require same medium for absorption. Okay. So ultimately all the drug reach in the blood, right? This process is known as absorption. What is absorption? How you will define absorption? Absorption is the movement of the drug from the site of administration. This is our administration of the drug. We have administered the drug by oral route. We can give it by any route. We can give it by IM, subcutaneous, rectal. You know, there are various routes. So by any route, if we are giving the drug ultimately reaches the blood. So movement of the drug from the site of administration to circulation. Circulation means blood. This movement is known as absorption. So we are done with the first portion, absorption. I will tell you the details. This is the definition. What is the definition? I want to teach you 4 parts here. In pharmacokinetics, I want to teach you 4 parts. First, I will teach you absorption. Then I will teach you distribution. Then I will teach you metabolism, that is biotransformation, also known as biotransformation. And in the end, I will teach you excretion. So ADME is the mnemonic of pharmacokinetics. Pharmacokinetics is relatively bigger one and pharmacodynamics is relatively smaller. I will teach you both today, right? So in pharmacokinetics, I will first teach you the 4 definitions. What is absorption? What is distribution? What is metabolism? What is excretion? Then we will see each part individually and the important points under each part. Everyone give me a thumbs up in the chat box. I can clearly see your chat, right? So Tejaswini, Kuldeep, Osama, Anu. Yes, you got it. I can see only 4 names till now, right? So you got my point. Okay, so let me move ahead. So this is absorption. What is absorption? It is movement of drug. Movement of drug, what to what? Movement of drug from the site of administration till circulation. This movement is known as absorption. Okay, so I will tell you the details of absorption. After absorption, now drug is in blood. From the blood, drug will move to its site of action. Site of action can be any organ. If I'm having a headache, my site of action of the drug will be my brain, right? If I'm having diarrhea, the site of action of the drug will be intestine. If I'm having heart failure, the site of action of the drug will be heart. So depending on the disease, where are the receptors of that drug? Drug will move to that particular organ inside the human body. We have various organs, numerous organs. Drug will move in all those organs wherever receptors are present. That may be the site of action of the drug. After moving inside, now this is known as distribution. This is known as distribution. So what is distribution? Distribution is the movement of drug from circulation to site of action, to tissue. You can say to tissue. It is known as distribution. So absorption is movement of drug from site of administration to circulation, right? And distribution is movement of drug from circulation to tissue. Everyone give me a thumbs up if you got the 2 definitions, absorption and distribution. You got the 2 definitions? Yes? Everyone? I want everyone to participate. Come on. Everyone give me a thumbs up first. Everyone. So can I move ahead? So this is distribution. Okay. After moving inside the site of action, drug will show its mechanism of action here. The drug will show its mechanism of action here. So this part is pharmacodynamics. Don't include in pharmacokinetics. That I will teach you next chapter, pharmacodynamics. What the drug is doing to the body. So that is next chapter. Now just imagine pharmacodynamics is done. The mechanism of action of the drug is done. Drug has already shown its mechanism that disease is cured. Migraine is cured, diarrhea is cured, whatever is the disease, it is cured. Now I want to excrete the drug. I want to excrete the drug. So drug will go to the kidney. Kidney, can you excrete me? I want to go out of the body. I am a drug. I have done my job. So kidney will say, no, I cannot excrete you because you are a non-polar drug. and from my urine is water, so only polar drugs can be excreted from kidney. So kidney says no to the drug. Kidney is asking the drug, you first go to the liver. Liver will convert you from non-polar to polar, then come to me, right? So the drug, after showing its mechanism of action, is going to the blood again. From the blood, the drug is going to the liver. In the liver, non-polar drug get converted to polar drug. This is known as the third step, metabolism. Either you say metabolism or you say biotransformation, one and the same thing. So metabolism and biotransformation are same. It converts non-polar drug to polar drug. It takes place in liver. Once the drug get converted into polar, again it will come in the blood. Non-polar drug enter in the liver, get converted to polar, and polar drug again come in the liver, again come in the blood. And from blood, now it will go to the kidney and get excreted out of the body. This is last portion, excretion. So tell me the four portions of the pharmacokinetics. What body does to the drug? So body first basically absorb drug, then distribute drug, then metabolize drug, and excrete drug. These are the four portions what the body is doing to the drug, not drug to the body. Drug is doing mechanism of action to the body, only one thing. So first we have absorption, distribution. These are the two parts of pharmacokinetics. Then we have mechanism of action, that is pharmacodynamics. Then we have remaining two parts of the pharmacokinetics, that is metabolism and excretion. This is the complete sequence. So pharmacokinetics have four portions. After first two, we have pharmacodynamics, and then we have next two. But we will first finish these four together, and last I will teach you the mechanism of action. Everyone give me a thumbs up if you got an overview, what we have studied, what we are studying. First, give me an overview. You got the four definition. I guess everyone got it. Let me start pharmacokinetics if you got the overview. So till now, we have studied that in pharmacology, in pharma, we have two branches, pharmacokinetics and pharmacodynamics. Can you see? Pharmacokinetics is what the body does to the drug, right? And pharmacodynamics is what the drug does to body. Does anyone have any doubt? Does to body. Does anyone have any doubt? I guess no one have any doubt, right? So here what the body does to the drug, there are four portions: absorption, distribution, metabolism, and excretion. And what the drug does to the body, only one thing, mechanism of action. So these I want to teach you one by one. Let me start pharmacokinetics. In pharmacokinetics, the first I will teach you four chapters in pharmacokinetics: absorption, distribution, metabolism, and excretion. And after that, I will teach you one chapter in pharmacodynamics, that is mechanism of action, that is transducer mechanism, the various transducer mechanism. You got my point? Very good, very good. So be interactive. I'm getting the thumbs up from all of you. Prityush, Anu, Charmi, Shivlal, very good, everyone, very good. So let me continue with pharmacokinetics. So in pharmacokinetics, it is the quantitative study of the drug movement inside the body, through the body, and out of the body. That is what body does to the drug. We have four branches, we have already studied. So this is the main diagram, this is our master diagram. In this diagram, I will teach you everything. Now, if you have understood this diagram, you will understand complete chapter ahead. This is going to be my master diagram. Okay. So this diagram from KTT I have converted into my master diagram. This is the diagram actually given in KTT. So this is the same diagram which I have drawn in simplified version for you. In this diagram, you can see this is the site of administration. You are giving the drug by tablet route. So drug is ultimately going in the blood. So this portion is known as absorption. You got my point? So from the site of administration to the blood. After going in the blood, you can see the drug is moving to the various tissues. This portion is known as distribution, right? After that, it is going to the liver for converting non-polar to polar. This portion is biotransformation or metabolism. In the end, it is going to the urine for excretion, for kidney. So this is the same diagram which I want to show you here. Everyone give me a thumbs up. Shall I proceed ahead? I guess I should. Let me start the first chapter, drug absorption. I will teach you four chapters as I have told you. 1, 2, 3, 4. The biggest one is the excretion. Remaining three are small. We will give 10 minutes here. I guess 15 minutes here. I guess 15 to 20 minutes here. And this is the biggest one. It alone required 30 minutes, right? So this is I will try to complete in 1 or 1.5 hour the complete pharmacokinetics. All the important points in that. All important. Let me start absorption. From absorption, the first chapter absorption, 3 questions come in your exam. Absorption chapter, we say. Definition of absorption, factors affecting absorption, and bioavailability. These are the 3 questions for university exam must to attend from absorption, the first chapter. Okay. So definition you already know, I guess. It is the movement of the drug from the site of administration to circulation. You already know, right? Now coming on the factors. You got my point. Movement of the drug. This is site of administration to circulation, right? So drug is going in the mouth, in the esophagus, in the stomach, in the intestine, getting absorbed either from stomach or from intestine, ultimately reach in the blood. So this is absorption, movement of the drug from site of administration to circulation. We got it, right? Definition is done. Coming on the factors. The second thing is the factors. You must know the factors affecting absorption, right? What are the factors affecting absorption? Okay. So there are various routes, right? I will teach you three routes, the factors of three routes only. Main factors are GIT, that is oral route. So if you are giving any drug by oral route, the most common route is the oral route, most convenient, cheapest route is the oral route. We take tablets, capsule from mouth, that is oral route. So what are the factors of absorption? Does there are factors? Yes, there are, I guess, 11 factors for absorption. I will enumerate for all of them. Parenteral route, I mean, I'm giving the drug directly in the blood. So it can be IV, it can be IM, it can be subcutaneous, these injectable forms. And topical in the form of the ointments and in the form of eye drops. So I will tell you factors for them also, but main is oral. Oral ke liye from GIT, these are the 9, not 11. I'm sorry, 9 factors. I'm having 9 factors with me. I will explain you these factors one by one. The most important is the last one. Rest are very easy, you can understand them. Okay. The first factor is aqueous solubility. Aqueous solubility. You tell me, there are some drugs which comes in the form of the syrup, that is liquid, and the same drug have tablets also. Which is better to take? Which is absorbed better? Better to take, I don't know. Which is absorbed better? Which is my question is absorption. Absorption liquid का ज़्यादा है कि solid का ज़्यादा? That is my question. That is aqueous solubility. Absorption of liquids are more as compared to compact form. You got my point? So syrups are absorbed better as compared to tablets or as compared to capsules. So tablets and capsules we take it with water or we take it with some liquid. So first the tablet get converted, get dissolved and converted into liquid, then it is absorbed. It is not directly absorbed from the mucosa of the stomach and intestine. You got my point? So aqueous solubility, solutions are absorbed rapidly as compared to compact doses, right? So we can say the tablets which disintegrate very rapidly absorb faster. Now we have two types of tablets. Tablet 1, tablet 2. Tablet 1 disintegrate in water very rapidly and tablet 2 disintegrate in water slowly. Both there are two patients. One by one they are taking the respective tablets 1 and 2. So tablet 1 will be absorbed faster because it disintegrates rapidly in water, it dissolves rapidly. So the patient takes it with sip of water and after going in the stomach, it gets dissolved in water and get absorbed. You got my point? So this is the aqueous solubility, right? After that, the second is the formulations. You know, we have various drugs, the capsules, the tablets, you know, various types of formulations are available. They contain the main active drug, main drug, whatever main drug I require for my disease. It can be NSAID, it can be any disease, right? Apart from main drug, it also contains some inert substances for the packing, you know, for compactness of the tablet. We apart from the main drug, we add some inert substances. In the inert substances, we add lactose, we add sucrose, we add starch, we add calcium, lactate, the color, for the compactness. So these all factors also affect absorption. They can increase, they can decrease, they can do both for the main drug. We cannot only give the main drug. We cannot only give the main drug. We give the main drug along with some inert substances. The inert substances cause the compactness of the tablet, give the colors, give the flavors, colors, and these things to the tablet. So these inert substances either can increase or decrease the absorption of the main drug. So that is the formulation. Give me a thumbs up. Aqueous solubility is done, formulation is done, third is concentration. Concentration is directly proportional to absorption. More is the concentrated is the drug, faster is the absorption. Dilute is the drug, lesser is the absorption. You got my point? So you can understand this like this. There are two patients. This is patient 1, okay, and this is patient 2, right? Stomach and intestine you can see of the two patients, right? Both of them are taking one tablet, the same tablet. The first patient is taking with full glass of water, right? The second is taking with sips of water, only few sips so that tablet can go inside. So here, after going inside, the tablet is dissolved in full glass of water. So it got dilute, right? Here the patient is taking with few sips of water. So tablet remain concentrated here. Both are dissolved. But after dissolving, one is dilute, one is concentrated, which will be absorbed faster. So concentrated will be absorbed faster. The dilute will be absorbed slower. You got my point? So concentrated tablets are absorbed faster as compared to the dilute solution. Concentration is directly proportional to rate of absorption. You got my point? That is the third. So aqueous solubility, formulation, concentration. Fourth is lipid solubility. Lipid solubility. Okay. Understand it like this. So all the drugs are absorbed either from stomach or from intestine, depending whether they are acidic or basic, right? Acidic drugs are absorbed from stomach in acidic medium and basic drugs are absorbed from intestine from basic medium. And this is the blood vessel. You can see just behind the stomach and intestine, we have a blood vessel. So this is our drug. This is our drug. So drug is going in the stomach or intestine. We want this drug to get absorbed and reach here. For absorption, it has to cross the cell, the mucosal cell of the stomach or the mucosal cell of the intestine. It has to cross that. So cell membrane cell membrane is made up of lipid. We know cell membrane of all cell is bilipid. So the lipid soluble drugs will come and dissolve in the cell membrane and easily cross the cell and move here. So lipid soluble drugs can easily absorb. The lipid insoluble drugs are less absorbed. So lipid solubility is a criteria. So the drugs which are lipid soluble are better absorbed as compared to the drugs which are not lipid soluble. Everyone give me a thumbs up. So that is also directly. So aqueous solubility directly proportional, concentration directly proportional, lipid solubility directly proportional to absorption. So and formulation can increase as well as decrease the rate of absorption. Coming on the next factor, surface area. You know, humans have intestine. The surface of the intestine is not flat. The surface of the intestine have villi. Why God has given us villi? If God wishes, God can give us intestine like this now. It can be flat from inside, but God has not given intestine like this. God has given the wall of the intestine is like this to increase the surface area. Got my point? Instead of flat, it is like this. It is like this. So surface area is increased. So whenever the drug is going inside here, so drug is having more and more surface area. It can be absorbed from anywhere. All have mucosal cells. So more is the surface area, more is the absorption. So it is because of villi, we have more surface area in the intestine. In the stomach also we have ragi. Ragis are there. The folds are there. You got my point? So surface area. Surface area is also directly proportional to the absorption. Lipid solubility also directly proportional. Concentration also directly proportional. Aqueous solubility also directly proportional. The next is the motility of the intestine. You know, we have peristalsis in the intestine. In the intestine, in the complete GIT, we have peristalsis. This is esophagus, this is stomach, and this is intestine. So whenever any drug is moving here, imagine the drug is present here, here, here. So imagine the two situations. The GIT is not doing peristalsis and the GIT is doing peristalsis. In which situation drug will be absorbed better? I'm asking to you. Which situation drug will be absorbed better? In the non-peristaltic, aperistaltic state or peristaltic? Whenever there is movement, there are more chances this drug will come in contact with the mucosal cell. So because the GIT is moving, the drug will come in more contact again and again with the wall, with the mucosa, so it will be absorbed better. So peristalsis directly proportional to absorption. More is the peristalsis, more is the movement of the drug, more chances it will come in contact with the surface of stomach and intestine, and it will be absorbed better. If no peristalsis is there, less absorption is there. So motility of the GIT is also directly proportional. Give me a thumbs up. So explain in your own words. Explain in your own words, right? Don't learn these factors. Just learn the list and you can give the explanation in your own words in your exam. Presence of other substances in the GIT. Of course, the presence of other substances. Other substances in the GIT along with the drug can increase absorption, can decrease absorption. In general, food decreases absorption. If you take any drug along with food, it decreases absorption. So you are a doctor now. Whenever you prescribe any drug to your patient, ki you take this drug for your disease, the first question patient ask you, doctor, khali pet lena hai ki khane ke baad? Doctor, I have to take it empty stomach or after food? This is the first question patient asks you. So in general, all drugs should be taken empty stomach if you consider absorption to be better, right? If it is taken after food, absorption is delayed. But some drugs, if taken empty stomach, they cause acidity as a side effect. To prevent that side effect, we ask the patient to take those drugs with food, after food, right? Otherwise, all drugs should be taken empty stomach. You got my point? So, presence of other substances in GIT. Vasculature of the absorbing area. GIT ka blood supply in anatomy, you may have studied, it is mesenteric artery. Mesenteric supply, mesenteric superior, inferior, mesenteric arteries are there. You may be knowing the blood supply. So more is the blood, more is the absorption. Vascularity, blood flow to the GIT is also directly proportional to absorption. The last, the most difficult one. Now you got it. Now you got the 8 factors. These were very easy. These all were very easy. The most difficult to understand is the last one. Everyone first give me a thumbs up. Ashwin, Kuldeep, Tejaswani, Shikhar. You got my point. Sakshi, Anu, everyone. Yes, shall I proceed? Till now you got it. So till now we have studied 8 factors. Let me enumerate 8 factors and coming on the 9th and the last one. So aqueous solubility directly proportional. Formulation can increase or decrease. They can do both. Concentration of the drug directly proportional. Lipid solubility directly proportional. Surface area directly proportional. Motility means peristalsis directly proportional. Presence of other substances can increase, can decrease. Vasculature directly proportional. So there are some factors which are directly proportional to the absorption, and there are some factors which either increases or decreases the rate of absorption. Everyone give me a thumbs up. Everyone. Now moving to the last factor, the pH. Does pH affect the rate of absorption? Yes. So we have 2 types of drugs. Now please understand. So effect of pH come for 3 marks in your university exam, right, in pharmacology, and you have to derive. Now the rule is very simple. Okay, let me first summarize pH, the funda of pH for drugs, right? We have 2 types of drugs, acidic drug, basic drug. Acidic drug, basic drug. We have two type of drugs. So acidic drugs are absorbed from acidic medium and basic drugs are absorbed from basic medium, right? For absorption, we require same medium, right? For absorption, this is all for absorption. For absorption from the, we require same medium. So basically, acidic drugs are absorbed from stomach because stomach have acidic medium, and basic drugs are absorbed from intestine because intestine have basic medium. For excretion, opposites are required. For excretion, acidic drugs are excreted in basic medium and basic drugs are excreted in acidic medium. This is a rule, right? For excretion, you require, the drug require opposite medium. For excretion, right? So acidic and basic. So excretion, you will see for absorption, we have two organs. Stomach is an organ with acidic medium and intestine is an organ with basic medium. So you are saying that acidic drugs are absorbed from stomach because acidic medium and basic drugs are absorbed from intestine because of basic medium. But for excretion, we have only kidney now. We have only one organ, kidney. We don't have two different organs, kidney 1, kidney 2, or we don't have. We have only one organ for excretion, kidney. For absorption, we have two organs, definitely, stomach and intestine. But for excretion, we have one organ, kidney. So the urine inside the kidney, the pH of the urine inside the kidney can change. If the urine pH is basic, if you want to excrete acidic drug, make the urine pH basic. And if you want to excrete basic drug, make the urine pH as acidic so that the drug will be excreted. Give me a thumbs up. So it is the pH of the urine. It is the pH of the urine and kidney. I know organ is one, kidney, but inside that organ, urine is there, and you can change the pH of the urine. You can, being a doctor, you can change the pH of urine. You can make the urine acidic. You can make the urine basic of your patient urine. It's your choice that which drug you are giving to the patient. So accordingly, you can change the pH of the urine so that that drug is excreted out of the body. Everyone give me a thumbs up if you got it. Everyone. So the rule says that for absorption, we require same medium, and for excretion, we require opposite medium. Okay, it's very easy to understand. You will say, ma'am, we got it. But the thing is derivation. So in mathematics, you know, there is a theorem to derive it. There is the derivation. How you will prove it? Prove for absorption you require same medium, and prove that for excretion you require. This is the summary, but how you will prove it? You have to prove it mathematically with the derivation, right? So derivation karke batao mujhe. This is a theorem. This is final, right? You cannot change it. But where is the derivation? You got my point. You want the derivation? It is difficult. I'm warning, it is difficult. So I will give the explanation for the students who got it. It's good. The students who don't got it, they just learn the summary. Okay, let me teach you the derivation now. As I've told you, the drugs are two types: strong electrolyte and weak electrolyte. Strong electrolyte drugs do not depend on pH because they are 100% ionized. But weak electrolyte drugs depend on pH. They depend on, and most of the drugs are weak electrolyte. So it depends on pH. Listen, I will explain you two drugs: acidic drug, basic drug. Listen here: acidic drug and basic drug. Everyone see here. Acidic. What is acid? Tell me some acid example. HCl, HNO3, H2SO4. Right? There are many acids. So can I say Ha is the acid? H is the proton. The definition of acid, all acid have a proton, like HCl, like HNO3, like H2SO4, they have a proton, right? And our drug is A. A is the drug. H is the proton, A is the drug. So HA is acidic drug. Give me a thumbs up. In the same way, tell me an example of basic drug. Tell me some example of bases. NaOH, KOH, CaOH, twice, magnesium OH, right? We have many bases. All bases have OH in them, hydroxyl ion. So can I say AOH is the basic drug, A is the drug, and OH, or let me write BOH here. Okay, I would like to write, okay, just a second, pen वापस कैसे आएगा? I use the eraser, I don't know how to come. Okay, BOH, B for basic drug. So here A is the drug, here B is the drug. यहाँ पे proton है, यहाँ पे OH. Everyone give me a thumbs up. How they split? Tell me how they split. So HA will split like H positive, A negative. Can I say H positive and A negative? And BOH will split like B positive and OH negative. It will split like. So this is the splitting. This is the split. This is the ionization. Everyone give me a thumbs up. Everyone. Listen. Till now you got it. So in acid, I will teach you everything about the acidic. So reverse will be true for basic. I cannot give you two theorems. Now it will take time. I will prove for acidic. The reverse is applicable for basic. So basic tum khud kar lena at your home. Later on you can do it. So I will prove everything for the acidic. Right? You just reverse it for the basic. So for acidic, where is our drug? Our drug is present here and our drug is present here. This is not a drug. This is a proton. This is a proton. So this drug, HA, is known as unionized drug. Unionized means complete. It is unsplitted. And A negative is known as ionized drug. Ionized. Ionized one means that it is already splitted. It is already splitted. So it is A negative. It is splitted. HA and E. You got my point? You got my point? So there is a rule. The rule says that unionized drugs, the complete one, the unionized one are the complete. They are unsplitted. They are not splitted. They are complete. Body likes unsplitted one. So body absorbs the unionized one. एंड द आयोनाइज्ड वन दे आर ऑलरेडी टूट गए हैं ना, वो ऐसा याद करो कि टूटे हुए को बॉडी एक्सक्रीट कर देती है और जो कंप्लीट है उसको रख लेती है. सो बॉडी एब्जॉर्ब्स द अनायोनाइज्ड वन एंड बॉडी एक्सक्रीट द आयोनाइज्ड वन. दिस इज अ रूल. You have to learn it. Don't no need to understand. This is a rule. The anionized one. So whatever this drug, body will absorb it, and whatever this drug, body will excrete it. So you will see, ma'am, how much will be the ionization? It depends on pH. Now here comes the rule of pH. So out of the 100, how much is this? Maybe 10 is this, 90 is this. So in that case, 10 is absorbed, 90 is excreted. Maybe 90 is this, 10 is this. Maybe in this case, 90 is absorbed, 10 is excreted. It depends on pH. Everyone give me a thumbs up. So this is the basic. You should understand the basic. You got my point? So the rule says that ionized drugs are excreted, the splitted one, and unionized drugs, the complete one, are absorbed. This is a rule. This is a rule. Now let me tell you a formula. In chemistry, you have studied in your childhood this formula. pH is equal to pK plus logarithm of ionized upon unionized. See, it is ionized upon unionized. So let me write this formula. pH is equal to pKa plus logarithm of ionized upon unionized drug. Everyone give me a thumbs up. What is pKa here? Can anyone tell me what is pKa? What is pKa? Can anyone tell me? You have studied this formula in your childhood. What is pKa here? Who will tell me? What is pK? What is pK? Okay, imagine this is my formula of the drug. Where is my drug? It is HA. It's split like H positive and A negative. Am I right? Imagine 50% remains like this and 50% is ionized. Out of the 100%, 50% split is there. Just suppose. So ionized is 50 and unionized is also 50. So keep 50-50 here. 50-50. 50-50 will cancel out. So it will be 1. Logarithm of 1 is 0. We know log 1. Log 1 is 0. Maybe you are knowing. So in that case, pH is equal to pK. Can I say pH is equal to pK? Because this value becomes 1. This value becomes 0. Log 1 is equal to 0. So pH is equal to pKa. So can I say pK is the pH at which 50% of the drug is ionized and 50% remain unionized? This is the definition of pK. It comes for 2 marks. What is pK? pK is that pH. pK is a constant. It is known as ionization constant. It is that pH actually at which 50% of the drug is ionized, at which 50% of the drug is unionized. Everyone give me a thumbs up. Now, the last thing. pH is equal to pKa plus logarithm of ionized upon unionized. Right? I'm teaching you everything for the acidic drug. Always remember, I'm teaching you for acidic drug. Right? For acidic drug, if I want to give acidic medium, and if I want to give basic medium, if I want to give 2 different medium to my drug is acidic. So let me write acidic in the center. Drug is acidic. And I want to give you 2 different mediums to my drug. Right? Acidic medium means I want to decrease pH. If pH is 7, acidic pH is less than 7. So I want to decrease the pH by 1 unit, -1, so that the medium become acidic. And for basic, I want to increase the pH by 1 unit. So 7 is the neutral now. Less than 7 is acidic, more than 7 is basic. So less pH is acidic and more pH is basic. We know that. I guess everyone knows it. If I consider 7 as neutral, right? So -1 will be the acidic and +1 will be the basic, right? So if I'm making this value 0, then at that point pH is equal to pK. Now once I want to make this value as -1 and once I want to make this value as +1. You got my point? Once I want pH is equal to pKa -1. And once I want pH is equal to pKa +1. So this value, which value? Which value? Log ionized upon unionized. Here I want this value to be -1. And here log ionized upon unionized, I want this value to be +1. I'm trying my best. I'm trying. This is the simplest version in the world I can give you for this theorem. It is given in KTT, CATSUM, like this only. Give me a thumbs up. Give me a thumbs up. So you tell me when this value will become -1. Let's talk about -1. -1. So logarithm of what thing will become -1? Logarithm of 1 by 10 is -1. So make it 1, make it 10. So logarithm of 1 by 10 is -1. And here logarithm of 10 by 1 is +1. You got my point? Logarithm of, so if you keep it 1 by 10, the answer will be -1. And if you keep it 10 by 1, the answer will be +1. Give me a thumbs up. Everyone give me a thumbs up. So here, basically here, understand now the last point. The last point, understand. Here you are keeping unionized more than ionized. Unionized more than ionized, that is 10 times more than ionized. Right? And here you are keeping ionized 10 times more than unionized. Am I right till now? Till now, am I right? So can I say for acidic drug, For acidic drug, see the summary now. Everyone see the summary. For acidic drug, whenever I am keeping acidic medium, the same medium. So whenever I am giving the same medium, ionized form is known. And ionized are absorbed. We know the rule. And the ionized is excreted. Right? Right. So whenever we are giving same medium, basically drug is absorbed. More 10 times absorbed as compared to excreted. And for acidic drug, whenever I am giving basic medium, that is opposite medium. So for opposite medium, ionized drug is more as compared to unionized. And we know ionized body excrete the ionized one and keep the absorbed one, right? Ionized one. So here excretion is more. So the summary is that for an acidic drug in acidic medium, the drug is absorbed, and for an acidic drug in basic medium, the drug is excreted. This is the derivation. Everyone give me a thumbs up. I tried. I will not repeat it. If you got it, it's good. If you don't got it, learn it. This is the summary, right? So, and opposite is true for excretion, right? So this is the formula, and this is how I have explained it beautifully. Next time, make this value 1, keeping it 50-50. So if it is 1, log 1 is equal to 0. Log 1 is equal to 0, so pH is equal to pK. So pK is that pH at which 50% of the drug is ionized and 50% is unionized. After that, I keep this value as +1 and I keep this value as -1. Once I keep it as +1 and once I keep it as -1, right? So in that I got the summary. This is my summary. This is my final summary. What is my final summary? For acidic drug, absorption. Acidic drugs are absorbed in acidic medium. Basic drugs are absorbed in basic medium. This is for absorption. Absorption occurs in same medium, right? For excretion, acidic drugs are excreted in basic medium and basic drugs are excreted in acidic medium. This true for excretion. For excretion, we require opposite medium. This is the summary. If you can understand, understand it. If you can't understand, learn it. Give me a thumbs up. For absorption, same medium is required. For excretion, opposite medium is required. One more way to say it. Absorption occurs of ionized form. Absorption occurs of ionized form, right? Absorption occurs of unionized form. The complete drug is absorbed, right? And excretion occurs of ionized form, right? So you can say acidic drugs are unionized in acidic medium, basic drugs are unionized in basic medium, or else acidic drugs are ionized in basic medium and basic drugs are ionized in acidic medium. This is the other way of saying. Whatever you want to say, whatever you want to understand, this is the summary. Give me a thumbs up. Jitne audience utti thumbs up. Yes, you got it, everyone. So this is written in front of you, the same thing. This is a golden rule. Never forget. So we are done. So implication are only two that I have told you, absorption and excretion. So acidic drugs, the acidic drugs like aspirin, they are absorbed from stomach because it is having acidic medium. And basic drugs like atropine, they are absorbed from intestine because it is absorbed because it has basic medium. So for absorption, same medium is required, right? That is the summary. So, and for excretion, the pH of the urine can be altered. So if you want to excrete an acidic drug, make the urine basic. And if you want to excrete a basic drug, make the urine acidic. So these are the two implications. I guess everyone got it. Yes or no? Yes or no? So till now, in the first chapter, absorption, we have learned the definition of absorption. We have learned the 9 factors affecting absorption. You know the 9 factors. The 9th one was the most difficult. Now the last thing I am teaching you here is bioavailability. Question can come on anything. So what is absorption? Can you tell me? It is the movement of the drug from the site of administration to circulation. The 9 factors, it is aqueous solubility, it is formulation, it is lipid solubility, it is concentration. There are many factors. The most important is the pH. I have explained you the funda of pH. For absorption, same pH required. For excretion, opposite pH is required. That's it. That's it. Coming on the last thing, bioavailability, it comes for 3-mark question in your exam or 2-mark question in your exam. So what is bioavailability? What is bioavailability? My next topic, last topic for this chapter, absorption. Then we will move on the second chapter. So what is bioavailability? Where is my diagram? I have not drawn my diagram. Just a second. I will show you my diagram again. This is my universal diagram. The master diagram. What is, just suppose I am giving 100 gram of the drug tablet here. This is my 100 gram tablet. How much will reach here? How much? Is complete 100 gram will reach here? No, never, never, never. So out of the 100, how much is reaching in unchanged form in circulation? Maybe 70, maybe 80, maybe 50. It can be any percentage. So the fraction of drug administered, the fraction of the drug administered, we are administrating 100. So the fraction of that which is coming in circulation, that is known as bioavailability. Everyone give me, it is never 100 for oral route. Why? Because absorption is never 100%. Absorption, the stomach and intestine never absorb. So whatever drug you are giving here, it is not that thing 100% it will be absorbed. It will be absorbed. Maybe it is 98, 99, but it is never 100. It is never 100. So absorption is never 100%, right? That is the first reason. And the second reason, after coming here, can you name this blood vessel? What is this blood vessel? Can you name what is this blood vessel where all the drugs are going? Name this blood vessel which I have drawn in this diagram. Can anyone of you? This blood vessel is a portal vein. Portal vein is the vein of the GIT, right? For stomach also, the drug is going in portal vein. From intestine also, the drug is going in portal vein. So ultimately, this is the portal vein. Give me a thumbs up. After coming here in the portal vein, I want the drug to go at the site of action and show its mechanism of action. But before the drug moves its site of action, portal vein goes to liver. So first, portal vein is a vein for liver. Now, portal vein arises from GIT and goes to the liver. We all know the anatomy, right? So drug first going in the portal vein. From the portal vein, the drug is moving to the liver first. To the liver, and in liver the drug is metabolized, the drug is degenerated. So most of the drug, not 100%, but this is known as first pass metabolism. This is known as first pass metabolism. And now after that, the remaining one is coming back to the blood, the remaining one. So it is never 100%. Now from here it will go to the site of action. So मेरे काम का तो उतना है ना जितना site of action पे जा रहा है. So if I'm having any disease, heart failure, तो heart पे जितना जा रहा है वो काम का है, otherwise वो कहीं भी जाए, how does it matter? So if I'm having any disease, I want the drug to reach at the site of action and show its mechanism of action. That particular dose of the drug is important for me. If I'm taking 100 and only 10 is reaching to the heart, so the remaining 90 is wastage now. So maybe wastage occurs at two places. What are the two places? It can be absorption. The stomach and intestine are not absorbing properly, and it can be first pass metabolism caused by the liver. Liver is degrading the drug before it shows its action. So that is first pass metabolism, portal vein in the liver. Give me a thumbs up. So bioavailability, what is bioavailability? Bioavailability is the fraction of the administered dose which is reaching in the circulation in unchanged form and shows mechanism of action at site of action. Bioavailability is never 100% for oral route because of two reasons. Number one, absorption is never complete. And number two, first pass metabolism. Because of two reasons, bioavailability is never 100%. Now imagine the same 100 gram of the drug. Instead of taking a tablet, I'm filling in a syringe. This is my syringe. And I'm giving directly IV injection to the patient. So all the 100 gram I will inject directly in the blood. So for IV route, bioavailability is 100%. Whatever dose you are taking, it is directly going in the blood. It is directly going in the blood without absorption ka chakkar nahi hai yahan, first pass metabolism ka chakkar nahi hai. So for IV route, only one route, IV, intravenous, bioavailability is 100%. Because in that you directly give the drug in vein. You directly give the drug in the blood. Give me a thumbs up. So what is bioavailability? Who will tell me the definition of bioavailability? This is bioavailability. It is the fraction of the administered dose. That is percentage of the administered dose that reaches the circulation, that reaches the blood in unchanged form, and it will show its mechanism of action. That percentage is known as bioavailability. Give me a thumbs up. Give me a thumbs up. For IV route only it is 100. But for oral route it is never 100. It is never 100. It is lower because of two reasons. Tell me the two reasons. ये दो reason 2 marks में आते हैं. 2 mark question in here. So first reason, it is never absorbed 100%. Absorption is never 100%. And second, it undergoes first pass metabolism. So you got what is first pass metabolism? Osama, Tejaswini, Ashwin, Kuldeep. You got it? Yes. So these are the two reasons. Now see the bioavailability of various routes. IV only it is 100%. Rest all routes, IM, subcutaneous, oral, rectal, transdermal, it is never 100. So it can be 99, I can say, but it is never 100. It is never 100. Only for IV it is 100. So mention this point in your exam. Everyone give me a thumbs up. Now the next point, how you calculate. You calculate bioavailability for a tablet. If I'm giving you any drug, this is drug A, I'm giving you, and I'm asking you, can you calculate bioavailability for this drug? You can say, yes, ma'am, I can do that. How you will do that? So there is a subject in front of you. This is your subject. I'm not saying patient. You will do experiment on this. This is your subject. So you are giving the drug to the subject, asking the patient to take the drug. Or you are giving it by oral route. By oral route, you are giving it. So all the drug gradually reach in the blood. Gradually, it will be absorbed and reach in the blood. And in every half an hour or 1 hour, you are taking the blood sample and seeing the concentration of the drug in that sample. And you are making a graph for it. So in the graph, this is the graph. So this is the time. So every 1 hour or every half hour, 0, 1, 2, 3, 4, you are taking the blood sample and seeing the plasma concentration. So on y-axis, I am taking plasma concentration. So how will be the graph? You tell me. So initially, you will say, ma'am, plasma concentration increase, because gradually the drug is absorbing from the stomach, intestine. It will absorb. All the drug which can be absorbed, it will be absorbed. So a peak will come. Now drug will go to the kidney and excrete, and again after some time, it will touch the baseline. So graph of all the drugs is like this. I'm drawing graph between two variables. What are the two variables? I'm drawing the graph between plasma concentration versus time. I have taken plasma concentration on y-axis and taken time on the x-axis. Everyone give me a thumbs up. Between two variables, I'm drawing the graph. So graph of the drug is like this. Now the rule says that calculate the area of this figure. Now if it is a triangle, you know the formula half into base into height. Whatever is the figure. For this figure, calculate the area. That area will give you the value of bioavailability. So basically, what is bioavailability? Bioavailability is the area in plasma concentration and time graph. Area is bioavailability. This is how we calculate it practically. Give me a thumbs up. So if you want to calculate the bioavailability of any drug, draw a graph. In that graph, take plasma concentration on y-axis, take time on x-axis, and make a graph. After making the graph, you calculate the area. So it is known as area under curve, AUC. Area under curve, AUC. AUC of that graph will give you the value of bioavailability. Whatever the answer, that is the bioavailability of that particular drug. It can be 90, it can be 80, it can be 70. For oral route, it is never 100. Now see, I have taken 100 grams of same tablet A, drug A, same drug. I'm giving by two different routes. So first, I'm giving the drug by oral route. So this is my graph. See the blue color I'm drawing. And same 100 gram I'm giving by IV route. So this is the graph. So you will calculate area of both graphs. See the blue graph, see the red one. The red one already includes the blue one. So which is bigger? Obviously, the red one is the bigger. So obviously, the bioavailability for IV is always more than oral for same drug for same dose. For same drug, you are giving same drug A. You are giving same dose, 100 gram, but you are giving 100 gram oral and 100 gram IV. So you can see the area of IV wala graph is more than the area of oral wala graph. So it is proven that IV ka bioavailability is always more than oral, because here it is always 100 and here it is never 100, it is less than 100. As much as it can be 98, 99, but never 100. Everyone give me a thumbs up. These are all points you have to write in your exam. Everyone give me a thumbs up. I am done with the first chapter. The first chapter in absorption, I taught you three things. Now I will move to the second chapter, distribution. Everyone give me a thumbs up. Absorption से तीन ही क्वेश्चन आएंगे यूनिवर्सिटी एग्जाम में. Definition of absorption, factors affecting absorption, उसमें भी most important pH वाला फंडा. There are 9 factors, but the most important is this one, right? And last one is bioavailability. If question is coming on bioavailability, what you will write? If it is a 3-mark question, what you will write? Can you tell me? Bioavailability coming in your exam, what you will write? If it is coming in my exam, I will write the definition of bioavailability, right? I will write the bioavailability of various routes. So what is the bioavailability of oral route? What is the bioavailability of IV route, right? And in oral route, it is never 100. It is never 100 in oral route. I will give 2 reasons for that. And I will write the method to calculate it. How to calculate bioavailability by forming a graph. So these 4 points I will write in my exam. So can you tell me the answers for that? What is the definition of bioavailability? Can you tell me Ashwin, Tejaswini, Charmi, Osama? Can you tell me Kuldeep? Yes. So it is the fraction. It is the fraction of administered dose which is coming in circulation in unchanged form. So that is bioavailability. What are the routes? By various routes we can give. For IV route, it is 100. And for all other route, it is less than 100. This is a rule. This is a rule. Right. Right. For oral route, it is never 100 because of 2 reasons. What are the 2 reasons? Absorption is never 100% and first pass metabolism is there. For some drugs, first pass. And how to calculate it? For calculating, make a graph. Make a graph between 2 things. Plasma concentration on y-axis and time on x-axis. And draw a graph. In this graph, the area under curve, AUC, will give you the value of bioavailability. Now compare the 2 graphs, one of oral and one of IV of the same drug, same dose. So you will find the IV one is larger than the oral one area wise. Everyone give me a thumbs up. Everyone give me a thumbs up. Shall I proceed ahead? Shall I proceed ahead? I am done with absorption. I am done with absorption. So Celestino, you are asking, you are from Fiji and you want Unacademy access, right? So you need an Indian mobile number. Maybe your relative, maybe your friend, maybe your colleague who is in India. So you can take the mobile number from that person for the help and you will get an OTP on that mobile number, the Indian number. And after the OTP, you can install the app in your own mobile. So you will just require an Indian mobile number of anyone, it will work and you can install the Unacademy app. So from your number, you cannot install, but from any Indian number, you can install. So that is my answer to you. Anyways, let me move further. Pharmacokinetics, the second chapter, I am starting distribution. Shall I start distribution? I am starting distribution. What is distribution? We are done with absorption. What is absorption? Movement of the drug from administration, from the point of administration to circulation. This movement, the drug will go in the esophagus, in the stomach, and in the intestine. It will get absorbed. Once it gets absorbed, it is in circulation. After circulation, the drug will move to the site of action, show its mechanism of action. Site of action can be any organ depending on the disease, depending on which organ the receptors of the drug are present. These are the receptors. It will move to the liver and convert from non-polar to polar before getting excreted. It cannot directly excrete it from the kidney. Before excretion, it will go to the liver, convert from non-polar to polar, and now we want this sequence. Listen, we want first the drug should go to the site of action and show mechanism of action. So drug first go here and again come in the blood. After that, drug go here, convert from non-polar to polar, and again come in the blood. And after that, drug go here and from the kidney and get excreted. But drug don't know the sequence. After coming in the blood, drug simultaneously move to the tree. Simultaneously move to the tree. Drug go to the site of action also. Drug go to the liver also, and drug go to the kidney also. If the drug is non-polar, kidney reject. Kidney reject the drug. Kidney say, don't come to me. I will not accept you. You are non-polar. First go get converted into polar. Then ask me. Right? So kidney will reject. TK, if non-polar, kidney will not accept. But drugs simultaneously move to the site of action and the liver. So this is known as distribution. So distribution basically movement of the drug. Movement of the drug from circulation to tissues. The tissue can be anything. The tissue or organ can be site of action, can be liver, can be kidney. If the drug is directly polar, some drugs are directly polar, they are not non-polar. So before showing their mechanism of action, they are simultaneously excreted also. You got my point? So basically distribution is movement of drug from circulation to the tissue. Tissue can be anything. Everyone give me a thumbs up. Everyone. Yes, yes. Yes, you are absolutely right, Charmi, Tejaswini, very good. That is the definition. So what is the drug distribution? My second chapter, delivery of the drug to the tissue. Delivery of the drug to the tissue is distribution. Give me a thumbs up. Everyone give me a thumbs up. Now listen the story of distribution. Here from distribution, questions come in your exam, or again 3 questions are important from this chapter. I am teaching you second chapter distribution. Here, first I taught you already the definition of distribution. It is delivery of the drug or movement of the drug from the blood, from the circulation to various tissues. That is distribution. Okay. Definition is done. After that, the most important thing is plasma protein binding. Here I want to teach you PPB. पे short note आएगा 3 marks का PPB. Very important. What is PPB and what are the implications of PPB? Implications are more important than definition. PPB, volume of distribution, VOD. Very important. Definition and implication. So definition of distribution. Here I will teach you 2 fundas. PPB क्या होता है and volume of distribution. Both are important for your university exam as well as competitive exam. Okay. Okay, so let me first teach you distribution का definition we have done. Now understand the story ahead. आगे क्या होता है? Listen like a movie story. Listen. So the patient is taking the drug by oral route. It is the tablet. The drug is going in the mouth of the patient. The drug is going to the esophagus of the patient. The drug is moving to the stomach of the patient, and the drug is moving to the intestine of the patient. If the drug is acidic, it will be absorbed from stomach. If the drug is basic, it will be absorbed from intestine. We have understood this mechanism. Ultimately, all the drug reaches the blood and absorption is complete, right? Whatever drug want to get absorbed, it is already there in the blood, right? Now, all the drug after reaching in the blood, a fraction of the drug will bound to a protein. Will bound. Blue color is the protein and red color is my drug. You got my point? So, some drug is free drug after coming in the blood. Some drug do not bound to the protein. It is known as free drug, FD. And some drug bound to the protein. It is known as bound drug, BD. So in the blood, we have 2 types of drugs. Free drug, bound drug. First, give me a thumbs up if you got this point. Now, the second question which may arise in your mind is that, ma'am, how much out of the total? Now, I'm considering total 100% drug in the blood, right? 100% means how much is free, how much is bound. So that depends from drug to drug. So that depends on plasma protein binding. The fraction which is bound, it is known as plasma protein binding of the drug. So some drugs have high plasma protein binding. So that is bound form is more and free is less. And some drugs have low plasma protein binding. So in them free is more and bound is less. You got my point? So it can happen that 90% is the free drug and 10% is the bound drug, or reverse can happen, 10% is the bound drug and 90% is the free drug. It depends from drug to drug. So various drugs have various plasma protein binding. If you say the name of the drug, I will tell you this drug is this plasma protein binding is the percentage of this drug. So it varies from drug to drug. We cannot make one rule for that. You got my point. But all drugs after reaching in blood, they have 2 forms, FD, BD. FD, BD. What are FD, BD? FD is the free drug. It is alone. And BD is the bound drug. It is bound to the protein. Can you name the protein? You should ask me, ma'am, which protein? Name the protein. So for acidic drug, the protein is albumin. And for basic drug, the protein is alpha-1 glycoprotein. Acidic drug bind to albumin. Basic drug bind to alpha-1 glycoprotein. Give me a thumbs up. So protein can differ based on the drug. Both proteins are present in blood. If the drug is acidic, it will bind with albumin. If the drug is basic, it will bind with alpha-1 glycoprotein. Okay, we got it. So you got my point. Till now, you got my point. Now out of the two drugs, in the blood we are having two drugs, FD and BD, which will go to the site of action. So only FD will go to the site of action and show mechanism of action. BD will not go to site of action. So active drug is FD. FD is active drug. It will go to site of action and show mechanism of action. BD is inactive. Give me a thumbs up. Which drug will go to the liver for metabolism? Again, it is the free drug. Free drug will go to the liver and convert from non-polar to polar. BD will not go for metabolism, only FD will go. And which drug will go to the kidney for excretion? Again, it is FD, which will go to the kidney for excretion. BD will not excrete it from the body. So you will say, ma'am, FD will go on decreasing. So whatever FD is there, for example, 90% FD is there and 10% BD is there. So 90%, much of which will enter in the site of action. It will enter in the liver. It will enter in the kidney. So concentration fall. So what is the use of BD in the body? BD works as a backup. It is a reservoir. When FD concentration fall, BD will convert into FD. So there is an equilibrium between them. You got my point? So out of the 90, just suppose it is entering here, and it falls to 20. So the remaining 10% BD will give it, and always they will make that proportion. You got my point? So this is the rule. You got my point? So this is the thing. Everyone first give me a thumbs up if you got it. So once the drug gain access to the blood, after gaining access to the blood, a variable proportion will bound to the protein. That proportion is known as bound form. And one proportion is not binding to the protein, that is known as free drug. Right? That is known as free drug. Free drug is the drug which goes to the three places. Free drug is the drug which will go to the tissue and show mechanism of action. It will go to the liver and show metabolism. It will go to the kidney and show excretion. So there is a fall in concentration of free drug. But the bound drug will give a backup. So there is a parallel decline in the free drug as well as bound drug. Both will parallelly decline. You got my point? So bound will dissociate when the concentration of free fall to give the backup. So what is the use of that? So acidic drugs bound with albumin, I already taught you, and basic drugs bound with alpha-1 glycoprotein. These are the names of proteins with which they are binding. So name of protein may be different in acidic and basic drug. Give me a thumbs up. So these are some examples of acidic drug in front of you. So barbiturates, benzodiazepine, NSAIDs, valproic acid. These are acidic drugs which bound with albumin. These are the name of important basic drugs which bound with alpha-1 glycoprotein. So for university exam, learn two examples are sufficient. But for competitive exam, if you are preparing for any of the competitive exam, learn the complete list. Any question can come. For university exam, 2 examples are suffice. To write 2 examples here and write 2 examples here. So write 2 examples of acidic drug which are binding with albumin, examples of basic drug which are binding with alpha-1 glycoprotein. Give me a thumbs up. Everyone give me a thumbs up. So this is the story. You got my point? So acidic drug is the active drug. Acidic drug is the active drug. It shows mechanism of action. Free drug is the active drug. Free drug is metabolized and free drug is excreted. It is the free drug which is doing all the things, not the bound drug. Bound drug is a reservoir. Everyone give me a thumbs up on this point if you got this point. Now I want to teach you the biggest concept, that is plasma protein binding. You got my point? Okay, volume of distribution बाद में बताती हूँ. पहले plasma protein binding के implications. Who will tell me the implications of plasma protein binding? What the definition of plasma protein binding? The bound drug is known as plasma protein binding. How much percentage is the bound one? The remaining will be the free. Total 100 में से bound is 90, remaining 10 is free. If bound is 10, the remaining 90 will be the free. So bound form is plasma protein binding because that percentage is bind with the protein. You got my point? So what is PPB? PPB is nothing, it is bound form. The bound form is known as, bound drug is known as PPB. That is the definition of PPB. You got what is the definition of PPB. You got the complete funda. You will draw the flow chart. Once the drug come in the blood, after coming in the blood, a variable proportion will bound with the protein. So that protein bound drug is known as BD, and that BD is PPB. BD का ही दूसरा नाम है PPB. Bound drug को ही कहते हैं plasma protein binding. So that is the bound drug. The remaining one is the free. So the free drug is the active drug. It will go to the site of action and show mechanism of action. The free drug will go to the liver and show metabolism, convert from non-polar to polar. And free drug will go to the kidney and get excreted. So it is the free drug which is going everywhere. So what is the use of bound drug? Bound drug is inactive. It do not go to the site of action. It cannot show site of action. It acts as a reservoir. It is neither going to the liver and getting metabolized. It is neither going to the kidney and showing excretion. Everyone give me a thumbs up. That is the first thing you should differentiate between the free drug and the bound drug. So plasma protein binding is the bound. Remaining is the free. You got my point? Give me a thumbs up. One more thing. Plasma protein binding से एक और चीज पता चलेगी. The onset of the drug and duration of action of the drug. Can you understand the difference? Do you know the difference between onset of drug and duration of action of the drug? Anu, Tejaswini, Osama, do you know the difference? Ashwin, you know what is onset of action? What is duration of action? The two different things are there. Imagine there is a person, there is my patient. The patient is having headache. Any disease we can take. Just suppose my patient is having severe headache. Severe headache. Patient is coming to me. I'm giving a drug to the patient to treat the headache. So I'm giving a drug. Drug can be NSAID, can be anything. This is my drug. The point at which I have given the drug, I can give the drug by any route. Just suppose I'm giving by oral route. So patient is taking the tablet, right? The point, the time from the drug administration to the time drug starts its action. It starts decreasing headache. It starts. It is known as onset. It is known as onset, right? Onset of action. So some drugs have fast onset, some drugs have slow onset. Immediately after taking, some drugs show action within 10-15 minutes, and some require 2, 3, 4 hours or maybe 24 hours, right? So onset is the time between drug administration and start of action. That is onset. That is about the onset, right? What about duration of action? Now drug will start acting and decrease the headache. So a headache is treated. But after how many hours headache will be repeated? So for how many hours this drug is active, and after that you have to take next dose. So after 6 hours, 10 hours, patient have same headache again. So the action is completed now in the body. You have to take another dose if you want the action again, right? That is the duration of action. Duration of action is the time for which the drug is active in the body. That is duration of action. You got the difference between onset and duration. This onset and duration, some drugs have more duration of action, maybe 24 hours, so you have to take once in a day. But some drugs have less duration of action, maybe 6 hours, so you have to take 4 times a day, right? Some drugs have to be taken once a day, some drugs have to be taken twice a day, some thrice a day, some 4 times a day. It depends on the duration of action of that particular drug. Give me a thumbs up. So onset and duration depends on ppb. It depends on, you will say, ma'am, how? Explain, please explain how. Okay, you imagine a drug. We will take 2 situations one by one and you will give me the answer. So you give me the answer. Okay, I will show you this flowchart later on. Okay, you got the funda now. It is the free drug which will go to the site of action and show mechanism of action. It is not bound drug. Bound drug will not go. Bound drug will remain in blood only. You know this point. If you know this point, you tell me the 2 flowchart. Let me take 2 drugs. I'm taking the first drug who is having high ppb. Who is having high ppb, and I'm taking a drug who is having low plasma protein binding. Tell me the significance of these 2 on onset and duration. How you will explain? High ppb means a drug in which bound form is more, that is 90%, it is more, and free form is less. Free drug is less, maybe it is only 10%. For example, it is like this. And low ppb means bound drug is less. Bound drug is the ppb, it is less, it is only 10%, just suppose. And free drug is more, opposite will be the free, so it is 90%. You got my point? Now you tell me, take the first situation. I'm taking this drug by oral route. So after taking the drug, all the drug reaching in the blood, most of the drug is bound. Most of the drug is bound and very less is free. So free drug goes to the tissue now. So what will be the onset? Onset will be slow. Onset will be slow. So only 10% drug is available for going to the site of action and showing its mechanism of action. 90% is not available. Only 10% is there, right? That will show. So onset will be slow. So after 2, 3, 4 hours, it will show its action. You got my point? But once it starts giving the action, duration will be high. Duration of action will be more. It will be more. It will be high because backup is more. Backup is 90. So drug keep on releasing. It will release slowly. It will release for the next 24 hours. So duration will be more. So onset is less. Onset is slow, but duration is more. So this is a drug. After taking, it takes much time to show its action. But once it start acting, it will remain there for much time. So ये काम बाद में करना शुरू करेगी 3-4 घंटे बाद, लेकिन एक बार करेगी तो लंबा करेगी. हिंदी में कहें तो it is like that. You got my point? You got my point? Let me see the another scenario. The second scenario. You tell me there is a drug. This drug I'm taking by oral route. So in this drug, bound form is only 10% after going in the blood. The free drug is 90. So all the 90 will go to the site of action and show mechanism of action. This 90. So onset is very fast. 90% of the drug is moving. So within 10 minutes, it will show its action. 10 to 15. You are taking a drug and immediately you are getting a relief, right? But the backup is only 10%. So it will show action. Duration of action is very low. Within 1 or 2 hours, its action is over and you have to take another dose. Onset is fast, but duration is less. You got my point? So there are 2 types of drugs available in the market. You can see the summary. It is in front of you. Everyone give me a thumbs up. There are some drugs in which onset slow but duration high. There are some drugs in which onset fast but duration low. You got my point? So based on ppb, it depends. So it depends on ppb that will decide the onset and duration of action. You got my point? Sometimes which drug you will prefer in emergency? Which drug you will prefer? You are a doctor now. You will prefer drug A or drug B? Which drug you will prefer in emergency? Osama, Charmi, Ashwin, Tejaswini. You all are doctors. Sakshi. सत्यम, इमरजेंसी में पेशेंट को कौन सा ड्रग दोगे? ड्रग ए की ड्रग बी? Which drug you will say? So yes, very good Kuldeep, very good. You will give drug B, the drug with low ppb, because you want onset fast. In emergency you want onset fast. Duration low hai chalega, you will repeat the dose. You will repeat dose after 1 hour, 2 hour, 3 hour, whatever. But onset you require a very fast onset because it is an emergency, you want to save the patient. But in elective case we can give drug A. So this is how it matters. Give me a thumbs up. So the same thing is written in front of you. So there are two type of drugs. Drugs having high ppb means bound form is more and free form is less. So less entry in the tissue. So reduce redistribution. So it delays the onset but prolong the duration. I have explained you. The second scenario, low ppb. So here free is more and bound is less. So more entry in the tissue. So fast response, fast onset, but duration of action will be less. You got my point? So this is how you have to explain this. So if question, yeah, one more significance. So one more significance is hemodialysis. What do you mean by hemodialysis? Do you know what is hemodialysis? Okay, there is the poisoning patient, suicidal patient in front of me. He is a 19-year-old boy. He is a 19-year-old boy. Imagine the situation. He got his results today, right? And he failed in the exam and he committed suicide. He tried to commit suicide. But parents noticed that boy is unconscious in the room and parents are bringing it to you. Doctor, save my child. He tried to commit suicide by taking this drug. They will show you the empty strip. They will show you the empty strip of the drug that he has taken 100 tablets of this strip and tried to commit suicide. And these are sleeping pills. We don't know what these are. And my boy, so please save my child. Right? They are trying and please. And you are a doctor. It's their moral duty to save the child. What you will do? What you will do? So at that time, there's a procedure which is known as hemodialysis. There's a machine, dialysis machine. Right? Hemodialysis machine in which blood is taken out of the body. It contains filters. Channi ke jaise. It contains a sieve. It contains filters, pores in the filters. उसमें से blood छान लो. You pass the blood through the filters and re-inject the blood, right? So this is a procedure done in many poisons. So will hemodialysis, how you will decide whether hemodialysis is useful in this case, yes or no? Does it depend from drug to drug, or for all poisoning cases you will prefer hemodialysis? For all poisoning cases. So the first thing here you will do, being a doctor, I'm telling you, first you will, if the boy is conscious, you ask the patient to vomit. So whatever drug is unabsorbed here, that will come out. You will do the charcoal lavage, gastric lavage. So whatever unabsorbed, that will come out by vomiting and lavage, right? But whatever already absorbed in the blood, what about that? It is absorbed now. You cannot take that. It is already absorbed. So most of the drug is already absorbed. For that, we are doing hemodialysis. We are taking the blood out. We are filtering the blood in a machine known as dialysis, and we are re-injecting it. So will you offer it for all drugs, or it depends on the drug? It depends from the drug to drug. You have to see the empty strip. What is the drug? It depends on plasma protein binding of the drug. Now there is a rule. The dialysis machine have pores now. I've told you these are the pores. These are the filters. Pores do not filter protein. Pores do not filter protein. Whatever protein present in blood, whatever going from above, it will come here. So pores cannot filter protein. Protein will pass from the pore. It is a rule, right? So whatever protein coming out, it will pass from the pore and it will be re-injected in the blood. Protein. So if the pores cannot filter protein, pores cannot filter the drug bound to the protein, that is bound form. So the drug, basically the drug which is having more bound form more, right? That is plasma protein binding more or bound form more. That drug, there is no use of doing hemodialysis. You got my point? There is a drug in which bound form is 90% and free drug is only 10%. This is drug A. And there is another drug, bound form is only 10% and the free form is 90%. This is drug B. There are two boys in front of you. One tried commit suicide by ingesting A. One tried committing suicide by ingesting B. In which you will offer hemodialysis to the parents, to the relatives. In which drug A wala boy ki drug B wala boy? Which boy you will offer hemodialysis? Common sense. You tell me. I've told you the funda. So hemodialysis do not filter protein. So bound drug will not be filtered. It will be re-injected. So there is no use now. In A there is no use. You will waste your time, you will waste your money, you will waste your energy. Only 10% ka fayda hoga. Remaining 90 will be re-injected. But here you will offer hemodialysis because 90% can be stopped. You got my point? So in B it is useful, in A it is not useful. You got my point? So hemodialysis depends whether you have to do hemodialysis. As you cannot do in case of emergency ki karke dekh lete hain, fayda hoga to hoga. No, it is an emergency. If hemodialysis is not useful, try some other procedure, right? So diuresis, the forced diuresis and other procedure. Got my point? So name the drugs for which plasma protein binding is very high. This is a list of drugs in which plasma protein binding is high and hemodialysis is no use. That's why don't offer hemodialysis to the relatives for these drugs. The mnemonic is avoid dialysis. These are the examples: A for amphetamine, B for verapamil, O for organophosphates and opioids, I for imipramine, D for digitalis, and D for diazepam. So learn these examples for university exam. Learn few of these, or you can learn all also, for which dialysis is not useful. Everyone give me a thumbs up. Everyone. So I have given you a short note on plasma protein binding. So in distribution, a short note will come on plasma protein binding. What you will write? If plasma protein binding coming in your exam, what you will write? Tell me. So first write the definition of plasma protein binding. In definition, draw the flowchart. I've shown you the flowchart, how to draw it, right? After that, start writing implications. In implication, write down the summary. What is a free drug and tell me what does it do. What is bound drug and tell me its implication, what it do. Tell me the effect of plasma protein binding on onset and duration of action, right? And tell me the effect of plasma protein binding on hemodialysis. So these are your 1, 2, 3, 4 points in case of implication. So in the flow chart in definition, you will draw that whenever we are taking a drug, the drug is absorbed. After absorption, the drug is reaching in the blood. In the blood, some drug is free drug, some is bound to the protein. That is known as bound drug. Bound drug can be bind to albumin. If it is acidic, it can bind to alpha-1 glycoprotein. It is basic. So we have two forms, free and drug. Free drug and bound drug, right? That is in the flowchart you will explain. So bound drug is the plasma protein binding. You got my point? The remaining one is the free, right? In the implication, you will write free drug is active. It will show its mechanism of action and site of action. It will go to the liver and show metabolism. It will go to the kidney and get excreted. Bound drug neither show mechanism of action, nor go to the liver, nor go to the kidney. So it is only a reservoir. It is only a reservoir. You will write that. Onset and duration of action, you will draw two flow charts. The drug which is having high ppb, onset is fast, but duration of action is low. The drug which is having low ppb, onset is slow, but duration of action is fast. You got my point? Hemodialysis is of no use in the drugs having high ppb. Right? You will explain why, and you will give the examples of such drugs. That's it. If you write everything, you will get full 3 marks in your exam. Everyone give me a thumbs up. This is a short note or long note, whatever you say on PPB. Everyone give me a thumbs up. My next topic to teach you is volume of distribution. I want to teach you volume of distribution. Then I will come on the third chapter. That is metabolism. Everyone first give me a thumbs up. I'm coming on volume of distribution. Give me a minute. This is volume of distribution. First, everyone give me a thumbs up. First, everyone give me a thumbs up. Are you people there? Shall I start now? It is difficult. Again, I will try hard. I will try hard. But I cannot guarantee that all of you will get the meaning of volume of distribution. But I will try hard. It is not volume of distribution. It is actually apparent volume of distribution. What do you mean by apparent? I will explain you. What is the meaning of apparent? I will explain you. Okay, I have told you this summary, this story. You already know what is shown in this diagram. What is distribution? Once the drug got absorbed, once the drug is in blood, it got absorbed. After coming in the blood, it is moving here, here, and here. This is known as distribution. Distribution is the movement of the drug from blood to tissue. From blood to the tissue. Tissue can be anything. The tissue can be the site of action. Tissue can be liver. Tissue can be kidney. Basically, drug is leaving the blood and moving some tissue. That is known as distribution. So can I say during distribution, drug either moving to site of action or liver or kidney, its concentration in the blood will gradually fall. Can I say this? Yes, of course. You will say, my common sense. Yes, it is like that, right? So can you give me an experiment that distribution actually happens in body? I'm saying and you are believing it is not a good thing. We should do experiments. Yes. So can you tell me an experiment in which we can prove this actually happens in human body? This actually happens. Distribution usually actually happening in human body after coming in the blood. Drug is leaving blood and moving to the tissue. Does it actually happen? We will do an experiment. So there is a subject in front of me. There is a human being who is my subject on which I will do the experiment. So I will take a syringe in which I will fill 1000 milligram of the drug. Can you see how much I am filling? 1000. So this syringe contains 1000 milligram of a drug. I am doing an experiment. Please understand. It is very easy. The diagram is from KDT Tripathi book. It's a very good book. Very easy book to understand. Some diagrams are from CADSM. Right? The theory is from CADSM. Anyways. Take a syringe. Fill the syringe with 1000 milligram of the drug. And give this 1000, complete 1000 IV to the subject. So can you see I am giving directly IV. Don't give oral. So all the 1000 reach the blood. In IV, the bioavailability is 100%. We already know it. Yes or no? So all the 1000 reaches the blood. Yes or no? You say, ma'am, yes. It's very easy. Take 1000 milligram. Give it IV. All the 1000 which was there in the syringe, already there in the blood of the patient. Now, blood of the patient contain how much drug? It is 1000. We have assured it by IV route. We not We have not tried by oral or other route. We don't want to take any chance. All the 1000 is injected directly in the blood. So blood contains 1000. Yes or no? After few minutes, after half an hour or 1 hour, after few minutes, take the blood sample in a test tube. Take a test tube and take the blood sample and see the plasma concentration of the drug in that sample. See the plasma concentration. So you found out, this is a real experiment. You found out plasma concentration to be like this. This is the plasma concentration. So it is 50 milligram per liter. What do you mean by that? 1 liter of blood contains 50 milligram of drug. This is the meaning. But how much you have injected? You have not injected 50. How much you have injected? You have injected 1000. How much you have injected? You have injected 1000. Now every liter contains 50. To accommodate 1000, how many liter of blood you require? To accommodate 50 liter, to accommodate 50 milligram of the drug, 1 liter of the plasma is required. 1 liter of blood or plasma is required. But I have not injected 50. This is my plasma concentration. I have injected 1000 milligram to the patient. So for accommodating 1000 milligram, 1000 by 50, that is 20 liters of blood is required. Every liter carrying 50. First liter 50, second liter 50, third liter 50, fourth liter 50, sixth liter 50, seventh liter 50. So 50 in every liter. So total 20 liter can accommodate the 1000. 50, 50, 50, 50, total 1000. Everyone give me a thumbs up. Oh, what you are saying, 20 liter. Oh my God, humans don't have 20 liter of blood. Humans have maximum 5 liter of blood. We all have 5 liter of blood. We, you, me, all of us have only 5 liter. But you will say, ma'am, answer is coming 20 liter. How it is coming? How it is coming 20 liter? That's why it is known as apparent. This is volume of distribution. It is apparent. It is not real. It is looking like volume of distribution, but it is not the real. It is apparent. Actually, we have 5 liter, but the answer is 20 liter. So you will say, ma'am, how it is possible? Why the answer is coming like this? Why the answer is coming like this? Just a second. Give me a minute. Okay. Answer is coming like this. You got my point. You got my point. Okay. So here we want 5 liter. So 200 will be there. Okay. Okay. So this is the thing. So while doing this experiment, we have not considered distribution. What we are considering, whatever drug present in the blood, it is present in the blood only. So we have considered, we are giving 1000 milligram. We are considering all the 1000 milligram to be present in the blood only. But actually it is not the case. 1000 milligram is not present in the blood. Most of it already moved to the tissue. Most of it already moved to the tissue. That's why our answer is coming like 20 liter. If all the drug remain in the blood only and distribution is 0, it is not going to the tissue, then our answer will exact come 5. So if we take the blood drug, considering distribution, it is 50 gram per liter. If distribution is not there, now it will be 200. Remaining 150 is already moved to the tissue that we are not considering. It will be 200. Now for 200, you will do answer will be 5. 1000 by 200, it is 5. You got my point? So if distribution is not there, answer will be 200. But distribution is there, so that's why answer is 50, because remaining 150 milligram already moved to the tissue. So in the blood only 50 is remaining. The remaining 150 moved to the tissue. I'm not considering that. If I consider that, answer will be exact 5. But if I'm not considering that, answer is coming 20. That is apparent volume of distribution. That's why it is apparent. So apparent volume of distribution is the volume of the plasma or the blood that accommodate all the drug. If I'm assuming the body as a unilateral compartment and I'm not assuming any single organ, I'm not assuming distribution. That volume of the plasma is known as volume of distribution. Now give me a thumbs up. Give me a thumbs up if you got the definition. Volume of the plasma that is required to accommodate all the drug which is given IV. So to accommodate all the drug which is given IV, considering body as a single homogeneous compartment in the blood form only, I'm considering there is no redistribution. I'm considering drug is uniformly distributed in the blood and there is no distribution. That volume is known as apparent volume of distribution. I really tried hard. Everyone give me a thumbs up. Everyone give me a thumbs up on this point. So what is the formula of volume of distribution? Volume of distribution is 1000. In our experiment, it is 1000 by 50. So what is 1000? 1000 is the dose given IV. It is 1000. Can you see? By syringe, it is 1000. And what is 50? 50 is the plasma concentration. So the formula of volume of distribution, dose given IV upon plasma concentration. Learn it. So if volume of distribution question come in my exam, in my university exam, this question will come for 3 marks. Right? What I will write? I will write the definition. I will write the definition. I will write the formula. And I will show that experiment in which that formula is derived. experiment. I will write about that experiment. Everyone give me a thumbs up. In the definition, I will write down what I will write down. It is the volume of plasma that is required to accommodate all the drug that is given IV. We are giving a drug IV to accommodate that drug, the plasma which is required, considering the body as a homogeneous compartment, single, and I'm not considering distribution. There is no organ in the body. I'm considering body is homogeneous, there is no organ. But it is not the real situation. We have multiple organs, and after blood, the drug is moving to all the organs. It is moving to the kidney, liver, and site of action. Give me a thumbs up. What is the formula? Who will tell me the formula? The formula of volume of distribution is equal to dose of the drug given IV, that is 1000 milligram in our case, in our example, upon plasma concentration. In our case, it is 50. So 1000 by 50 will be 20 in our experiment. So write about the experiment. It is not necessary that in the experiment you draw a blood vessel. In the blood vessel, whatever amount you want to give IV, you give it. It is not necessary. In my experiment, I have taken 1000, you also take 1000. Whatever amount you want to take, it is the example given in the book. So 1000 gram, I am giving IV. Draw like this, right? And take a blood sample. In the blood sample, after a few minutes after injecting, it is 50 gram per liter. So 1 liter contains 50. So answer will be 20 liter. 20 liter contain the 1000. So this 20 liter is volume of distribution. This is not a real situation because human contain 5 liter only. That's why it is known as apparent. Don't say volume of distribution, say apparent volume of distribution. I really tried hard. It was a hard topic. I guess none of the person in this world will simplify volume of distribution to such an extent for you people. Give me a thumbs up. Give me a thumbs up. To be very frank, when I was in second prof, now I don't understand all these things. Right? It is a very big thing which I'm telling. I'm confessing in front of you. I don't understand all these things. That was it seems to be very complicated. But there was no one to explain me the concept in such a simplified manner. But now I can understand all these with very ease. You got my point? Okay. So we are done with distribution also. So from the chapter distribution, how many questions will come in your exam? I'm done with the second chapter. We are done with the first chapter, absorption. In absorption, we have seen the definition of absorption. We have seen the factors, the 9 factors of absorption, in which the most important factor was pH and ionization. And we have seen other factors also. And we have seen a short note on bioavailability. How to calculate it? What is the graph of bioavailability? What is the definition? Various routes have various bioavailability. We have seen that. In the chapter distribution, we have seen the definition, the flow chart of the distribution, the 2 forms of the drug, free drug, the bound drug. The bound drug is plasma protein binding. So we have seen a short note on plasma protein binding. What is plasma protein binding? We have seen the implications of plasma protein binding. Free drug is active, it is metabolized, it is excreted. Bound drug is not active, not metabolized, not excreted, it is a reservoir. Right? We have seen the onset of action and duration of action. We have seen hemodialysis. So free drug, bound drug, onset of action and hemodialysis, these are the 4 implications of plasma protein binding. Not only this, we have seen volume of distribution. Volume of distribution, we have seen the definition of volume of distribution. We have seen an experiment, how to calculate it. We have seen the formula. What is the formula of volume of distribution, apparent volume of distribution? It is dose given IV upon plasma concentration. That is 1000 by 50 in our case, in our experiment. Everyone give me a thumbs up. Everyone give me a thumbs up. So this is how we have completed 2 chapters till now. Now it's time to start the third chapter. So okay, I have to end this lecture because I'm having another link on the YouTube only where you are attending now. I'm having another link at that YouTube channel only, that is Unacademy Live, episode number 2. So I'm ending this lecture. I will take a break for 5 minutes. So it's 9:40 now. At 9:45, I will rejoin. At 9:45 a.m., I will rejoin episode number 2 of Pharmacokinetics on YouTube only, where you are attending at the same place. Join another link. You will see me live on this channel. Remain on this YouTube channel only. You will see me live after 5 minutes. So give me a break of 5 minutes and join episode number 2. I want everyone to come back on time. I will start the third chapter immediately, metabolism or distribution. It is very important. So thank you very much for this lecture. And I'm expecting everyone to come back for the next lecture just after 5 minutes.